A man fell ill in the middle of the ocean. Nobody panicked. Weeks later, 3 are dead. 29 passengers had already gone home, to America, Australia, Britain, Switzerland. They took the virus with them. The WHO says this is not COVID, but they're also saying human-to-human transmission cannot be ruled out. Is the world facing another pandemic? A potential hantavirus outbreak aboard a polar expedition cruise vessel is now triggering international contact tracing operations across multiple continents. On the MV Hondius, a Dutch-flagged expedition ship carrying passengers from 23 countries, a 70-year-old man fell ill on a ship in the middle of the ocean. Nobody panicked. Weeks later, several passengers are dead or infected. He died on April 11th. Nearly 2 weeks later, the MV Hondius docked at the island of St. Helena. His wife disembarked with him and boarded a flight to South Africa. She was taken off the plane in Johannesburg and died. A KLM flight attendant who had contact with her is now in isolation in Amsterdam. That is how fast this virus moves once it starts. The MV Hondius set sail from Ushuaia at the southern tip of Argentina on April 1st, carrying 147 passengers and crew from 23 countries bound for Antarctica and the remote islands of the South Atlantic. By the time the world found out what was on board, at least 29 passengers had already disembarked and scattered to their home countries. The Americans went to Georgia, Arizona, and California. The Australians flew to Australia. The British flew home to Britain. 3 people are dead. 8 cases have been confirmed or suspected. A man in Switzerland, who had left the ship early, tested positive after he got home. Health authorities stress that Andes hantavirus does not spread like COVID. The WHO has confirmed it. It is not considered airborne in the same way and typically requires prolonged close contact for transmission.
This is not coronavirus. This is a very different virus. We know this virus. Hantaviruses have been around for quite a while. There's a lot of detail that we know. I'm going to ask Anais to come in and say this, but I want to be unequivocal here. This is not SARS-CoV-2. This is not the start of a COVID pandemic. This is an outbreak that we see on a ship. There's a confined area. We have 5 confirmed cases so far. We completely understand why these questions are coming, and we are trying to provide all of the information that we can. That's why we're having a press conference here to give accurate information, and we're grateful for all of those out there who are asking these types of questions. But this is not the same situation we were in 6 years ago.
The virus they could be carrying is the Andes strain of hantavirus, the only strain in the world known to spread directly between humans. Andes hantavirus kills between 35 and 40% of those it infects, but it does not travel through the air the way COVID did. It requires close, sustained contact.
What our working assumption is that it is the Andes virus. It could not be, but we're assuming that it is until we determined otherwise, because we do know that in the past there has been some limited human-to-human transmission with this virus. The point being, regardless of which virus it actually is, we do know that some of the cases have had very close contact with each other, and certainly human-to-human transmission can't be ruled out.
The UK Health Security Agency has asked British passengers to self-isolate for 45 days. Contact tracing is underway across dozens of countries. Professor Robin May, Chief Scientific Officer at the UK Health Security Agency, was direct about what this means for ordinary people.
For the broader public not directly involved in this cruise ship, the risk here is really negligible.
The outbreak began in silence, on a ship at the end of the world. The race to contain it is now global. A deadly outbreak at sea, a rare virus on board, and passengers trapped far from shore. What began as a luxury voyage across the Atlantic has turned into a floating health emergency, raising urgent questions about containment, survival, and how far this silent threat has already spread. 3 people have died following a suspected hantavirus outbreak aboard a cruise ship sailing in the Atlantic Ocean, according to the World Health Organization. At least 1 case has been confirmed, while 5 more remain under investigation as health authorities race to understand the scale of the incident.
Who is aware of and supporting a public health event involving a cruise vessel sailing in the Atlantic Ocean? To date, 1 case of hantavirus infection has been laboratory confirmed, and there are 5 additional suspected cases. Of the 6 affected individuals, 3 have died and 1 is currently in intensive care in South Africa. Detailed investigations are ongoing, including further laboratory testing and epidemiological investigations. Medical care and support are being provided to passengers and crew. Sequencing of the virus is also ongoing.
The outbreak occurred on the MV Hondius, a Dutch-operated cruise vessel travelling from Argentina to Cape Verde. The ship had been on a weeks-long journey that included stops in Antarctica, the Falkland Islands, and other remote locations before the health emergency unfolded. The first reported victim was a 70-year-old man who died on the ship. His body was later removed at St. Helena, a remote British territory in the South Atlantic. His wife subsequently collapsed at an airport in South Africa while attempting to return home and later died in hospital. A third fatality has also been reported, with the body still on board the vessel as it remains off the coast of Cape Verde. 2 additional individuals, believed to be crew members, are reportedly in need of urgent medical care, though local authorities have not yet approved their transfer ashore.
Yeah, unfortunately, there are no specific vaccines for hantaviral diseases. There are no specific antivirals to treat the disease in humans with. Treatment primarily is supportive care, so early identification of cases, seeking medical attention, and getting into facilities that are capable of assisting, for example, in this case, with the respiratory distress portion of the disease. That's really critical. But specific medical interventions, just nothing exists at this time.
Around 150 tourists and approximately 70 crew members were believed to be on board at the time of the outbreak. Health officials in South Africa have begun contact tracing efforts, particularly in Johannesburg, where 1 infected passenger is currently receiving intensive care treatment. Hantavirus is a group of viruses primarily spread through contact with infected rodents, particularly through inhalation of airborne particles from urine, droppings, or saliva. While rare, the infection can be severe and potentially fatal. The virus is known to cause 2 major illnesses. Hantavirus pulmonary syndrome affects the lungs and carries a mortality rate of around 38%. It typically begins with flu-like symptoms such as fatigue, fever, and muscle aches, before progressing to respiratory distress. The second condition, hemorrhagic fever with renal syndrome, affects the kidneys and can lead to internal bleeding, low blood pressure, and acute kidney failure in severe cases. There is currently no specific cure or targeted treatment for hantavirus infections. Medical care focuses on managing symptoms, including oxygen therapy, ventilatory support, and, in critical cases, dialysis. Global data suggests that approximately 150,000 cases of hantavirus-related illness occur each year, primarily in Europe and Asia. However, outbreaks on cruise ships remain extremely rare, adding to the concerns surrounding this incident. Health authorities emphasize that early detection and supportive care significantly improve survival chances. Preventative measures focus on reducing exposure to rodents and avoiding contact with contaminated environments.